As a father of three, this really caught my eye. Tooth decay is the #1 chronic infectious disease among children in the United States, and it's on the rise. But why? Here to explain how to fight those mouth monsters, Dr. Warren Brill, the president of the American Academy of Pediatric Dentistry and parenting educator, and mom, Rosie Pope. Good morning to both of you.
Good morning, Mike.
Good morning.
You know, I got my kids to brush their teeth. I've got three. My 3-year-old right now, when he was about 2, I told him I got to get the bugs off his teeth. So every time we go brush his teeth, I got to get the bugs off my teeth. But which brings to a good question. When's a good time for a child to make that first dental visit?
The first dental visit should be made at eruption of the first tooth or age 1, whichever comes first, so that we can show you how to get your youngsters' teeth clean, keep them clean, so that they can have good growth and development of the teeth and jaws and have a cavity-free life.
Yeah, okay, now talk about the dental health for kids, because you know, some parents maybe don't think it's as important when they're that young. Why is a child's dental health so important?
Well, a cavity is an infection of the tooth. You don't want the infection to spread. That's #1. If it does spread and you do get a cavity, it can cause discomfort. It can cause so much discomfort when your child gets to school that they can't concentrate properly, they can't eat properly. So dental decay, which is essentially 100% preventable, is something that you can work on from day 1 when that tooth first comes in, and your pediatric dentist can show you how to do that to make it a fun and pleasant experience. And I think, Rosie, you can relate to that.
Yeah, I think it's also important to understand that, as adults, we often have a lot of fear about the dentist, perhaps because of our own experiences. And getting your child to a dentist by their first birthday means there aren't going to be a lot of problems. What there is going to be is, a really great, fun experience with a pediatric dentist, learning about taking care of your teeth and getting your child involved, so it becomes a very regular habit, just as much as going to the pediatrician, rather than being something to be afraid of.
And Mike, your viewers can go to a website, mychildrensteeth.org. We'll find all kinds of helpful hints as how to do this. And there's also a pediatric dentist finder on the website, so they can find a pediatric dentist in their community that can help them make this a happy future for their kids.
Yeah, one of your concerns is the cause of the alarming rate of tooth decay among children. We have fluoride in our water, and it seems like, when I was a kid, there was, more cavities. And then as I got older, we had the fluoride protected your teeth a little bit, but it seems like you're saying it's on the increase. What's leading to that increase of tooth decay?
I think a lot of it has to do with what we're eating, what we're giving our kids to eat. If it's a lot of sugar, especially if it's sticky sugar that sticks to the teeth, and you don't get in there to brush and floss the kids' teeth right away, it can be a problem. That's why seeing the dentist at age 1, bring them into a pediatric dentist, will show you how to do this so that you minimize any ill effects that a poor diet might have. But while you're in our office, we'll also show you the foods that are good to eat and the foods that can help promote dental health and overall health. I'm sure that your pediatric dentist has done that with you, Rosie.
Yeah, absolutely. They taught me things as a parent that I didn't know, as well as taught my children things. And you mentioned a little earlier on in the program about those bugs. What we've done on mychildrensteeth.org is have these monsters that represent those bugs, represent that decay, so that children can have fun with it and understand what they're brushing away and what they're flossing away. And the more you can get your child to be invested in this process, the easier it will be for you as a parent, and the longer they'll be able to continue this great oral hygiene into the future.
Yeah, Rosie, you talked about those monsters. What's this monster-free mouths movement?
So the monster-free mouth movement is a really fun way to help educate children about the tooth decay. And instead of calling it tooth decay or cavities or all these other things, we've created little characters, little monsters that have names that the children can get to know and understand better, and then obviously want to brush away. It's a fun thing. It's a fun way to get educated and to get your children involved.
Yeah, Doctor, you mentioned that website. How about that website one more time to remind our viewers where they can go?
Absolutely. mychildrensteeth.org.
Fantastic. Dr. Brill and Rosie, thanks for your time this morning. Good information.
Thank you, Mike.
Thank you.
All righty, Mary, over to you.